Maintain healthy blood pressure with these 6 essential vitamins. Elevated blood pressure occurs when your heart has to exert greater effort than usual to circulate blood and oxygen throughout your body. Prolonged high blood pressure can lead to damage to the inner walls of your arteries, causing them to become less flexible and more rigid over time. This increased rigidity can eventually result in blockages, significantly raising your risk of experiencing a heart attack, stroke, or blood clot. So, when you have your blood pressure checked, and it consistently reads 140/90 or higher for several days, it is classified as high blood pressure. But what factors contribute to the development of high blood pressure? The primary cause is often an excessive presence of insulin in your bloodstream, which stimulates a part of your nervous system that elevates your blood pressure. This excess insulin is typically a result of consuming a diet rich in refined carbohydrates such as sugar, soda, bread, cereals, cakes, and other flour-based foods. Additionally, a deficiency in dietary potassium can lead to fluid retention, further increasing pressure on your arteries and heart, elevating your blood pressure. Another significant contributor to high blood pressure, or hypertension, is elevated cortisol levels, a hormone released during periods of stress, tension, or fear. Regular exercise is crucial for maintaining a strong and healthy heart muscle. Without adequate exercise, the heart muscle weakens and must work harder to pump blood, increasing blood pressure. Furthermore, deficiencies in magnesium, vitamin C, or vitamin D can cause arterial constriction, forcing the heart to work harder and raising blood pressure. When you consult your healthcare provider, they may prescribe medications such as ACE inhibitors, beta blockers, or calcium channel blockers to lower your blood pressure. However, these drugs often come with various side effects, as they deplete antioxidants and mineral reserves, potentially worsening the underlying issue. Fortunately, there are natural approaches involving vitamins, minerals, herbal remedies, and nutritional supplements that address the root causes of high blood pressure rather than merely alleviating symptoms. In this video, we will explore the top 6 methods for naturally lowering blood pressure. It's important to note that the term vitamins is used broadly here to encompass minerals, herbal remedies, and nutritional supplements that can effectively reduce blood pressure. The first item on my list involves combining vitamin D3 with K2. It may not be apparent, but there is a widespread deficiency of vitamin D worldwide, which has been linked to increased blood pressure and elevated cortisol levels, the stress hormone. Vitamin D assists in relaxing both the smooth muscle in your arteries and the thick muscle in the middle layer of your heart, thus reducing blood pressure. If desired, you can take 20,000 IUs of vitamin D3 daily, along with 200 micrograms of vitamin K2 in the 7 Malawian kwacha's form. This combination will enhance your body's vitamin D levels and naturally lower blood pressure. It is crucial to include vitamin K2, as it synergizes with vitamin D to regulate calcium distribution throughout your body, preventing it from hardening your artery walls and exacerbating blood pressure issues. Additionally, you can naturally boost your vitamin D levels by exposing your skin to sunlight for at least 45 minutes each day. Number 2, we have niacin, which is one of the most effective remedies for preventing heart attacks. If you suffer from high blood pressure, clogged arteries, or high LDL cholesterol, you might consider daily niacin supplementation to reduce the risk of heart attacks or strokes. Niacin, also known as vitamin B3, has been extensively studied for its ability to vasodilate blood vessels, facilitating unrestricted blood flow throughout the body. Niacin also helps prevent inflammation and the formation of plaque within artery walls. For those interested in supplementation, a suitable dosage ranges between 500 to 1,000 milligrams of extended-release niacin per day. You may experience a flushing sensation or a rush of blood to your face and neck between 30 to 120 minutes after taking niacin. This is caused by niacin triggering prostaglandins, which dilate your blood vessels, improving blood flow. It is important to ensure that you choose the flushing type of niacin, as non-flushing niacin will not yield the same effect. Additionally, incorporating B3 or niacin-rich foods into your diet, such as nutritional yeast, salmon, turkey, and anchovies, is recommended. Number 3. Potassium and magnesium. Potassium is a mineral that works in conjunction with sodium, salt, to maintain fluid balance in the body. Regrettably, many people consume excessive salt and insufficient potassium from leafy green vegetables, leading to fluid retention within cells and increased pressure on the vascular system and arteries, resulting in high blood pressure and other heart issues such as palpitations or an elevated pulse rate. Like potassium, magnesium is another essential electrolyte mineral that assists in the relaxation and contraction of the heart, ensuring normal blood circulation. Increasing your intake of potassium and magnesium can address the root causes of high blood pressure by reducing cortisol, the stress hormone, insulin, the blood sugar hormone, and supporting the heart's pacemaker, known as the SA node. These minerals are abundant in leafy greens like Brussels sprouts, cabbage, arugula, beet tops, collard greens, broccoli, avocados, and pumpkin seeds. If you wish to further boost your potassium and magnesium levels, you can consider using a high-quality electrolyte powder containing at least 1,000 milligrams of potassium citrate and 100 milligrams of magnesium citrate, mixing it with water and consuming it twice daily. Number 4. Aged garlic extract. As you may be aware, garlic is renowned for its healing properties, containing a potent natural sulfur compound called allicin, responsible for its distinctive flavor and odor. Aged garlic extract has been extensively researched and shown to naturally reduce blood pressure by inhibiting angiotensin II, a hormone that typically constricts blood vessels and raises blood pressure. Garlic extract achieves this by enhancing nitric oxide production, a gas-like molecule that dilates and widens blood vessels, normalizing blood pressure. For those interested in herbal supplementation, a daily dosage of 2,400 milligrams of aged garlic extract can effectively lower blood pressure and reduce the risk of blood clots. Additionally, consider incorporating organic aged garlic, also known as black garlic, into your diet, either raw in salads or stir-fries. It has a sweeter taste compared to regular garlic and offers higher antioxidant content due to the fermentation process. Number 5 on the list is vitamin E in the form of tocotrienols. Many individuals experience a deficiency in the antioxidant vitamin E, primarily due to their high consumption of flour-based foods such as bread, cereals, biscuits, and pasta. The reason behind this is that when flour is subjected to baking and cooking processes, it undergoes oxidation, which results in the destruction of natural vitamin E content. As a consequence, this essential vitamin becomes unavailable to the body, depleting its own vitamin E reserves, which are absent from the processed foods. Inadequate vitamin E levels can lead to improper oxygen utilization by the heart, thereby increasing the risk of chest pain or angina, characterized by heart cramps, as well as an elevated risk of stroke or inflammation in the coronary artery. If desired, a daily intake of up to 300 milligrams of tocotrienols, a more potent form of vitamin E than the common tocopherols found in typical over-the-counter vitamin E supplements, is recommended. Vitamin E can also be obtained from natural food sources like sunflower seeds, avocados, hazelnuts, extra virgin olive oil, Swiss chard, and various leafy green vegetables. Number 6. Apple cider vinegar. As mentioned earlier, one of the primary contributors to high blood pressure is elevated insulin levels resulting from high blood sugar. To combat this, consider consuming 1 tablespoon of apple cider vinegar mixed with water before each meal. The acetic acid present in this vinegar is a short-chain fatty acid known to reduce insulin resistance and lower blood sugar levels, subsequently safeguarding artery walls from damage. You can also combine it with a bit of extra virgin olive oil to create a delicious and healthy salad dressing, which aids in the absorption of essential minerals like potassium and magnesium, previously discussed in the video. In a later segment of this video, we will delve into 6 lifestyle adjustments you can make to manage your blood pressure and reduce mortality risks. However, before we proceed, let's identify some warning signs that may indicate existing high blood pressure. Individuals with excessive abdominal fat should consider monitoring their blood pressure, as the elevated insulin levels responsible for belly fat accumulation may also elevate blood pressure. Furthermore, if you already have high blood pressure and one of your arteries is obstructed, you might experience chest discomfort or pressure, especially during emotional stress or physical exertion, with the pain subsiding when you relax. Another potential sign is breathlessness when ascending a flight of stairs, which can be attributed to low antioxidant levels and slightly elevated blood pressure. Nonetheless, in many cases, high blood pressure presents no noticeable symptoms, emphasizing the importance of regular monitoring. You can acquire a home blood pressure monitor. Alternatively, you can schedule routine checkups with your physician or nurse, but it's essential to measure it daily for 3 consecutive days, as occasional spikes in blood pressure are not indicative of hypertension. Now that you have this knowledge, let's delve into 6 lifestyle adjustments that can help you effectively manage your blood pressure. 1. Limit your consumption of caffeinated beverages such as coffee, tea, and soda to no more than 2 cups per day. Caffeine can stimulate cortisol, leading to fluid retention and elevated blood pressure. Consider substituting these drinks with natural antihypertensive options like hibiscus tea, chamomile tea, lavender tea, and herbal rose tea, all of which can naturally reduce blood pressure. 2. Incorporate foods into your diet that promote the production of nitric oxide, including beets, garlic, spinach, kale, leafy greens, beef liver, lemons, and watermelon. These foods boost nitric oxide levels, which help dilate blood vessels, enhance blood flow, and lower blood pressure. 3. Enhance your nitric oxide levels further by engaging in leisurely, extended walks in natural surroundings for at least 45 minutes each day, preferably in areas rich with trees and vegetation. This practice not only lowers cortisol but also enhances heart function. 4. Avoid alcohol, cigarettes, and vaping devices, as they deplete your antioxidant reserves, harming your heart and weakening your vascular system. 5. Prioritize improving your sleep quality by going to bed 1 hour earlier each night and disconnecting from all sources of blue light, such as your phone and television. Increasing your sleep duration naturally relaxes arteries, lowers cortisol and insulin levels, and elevates nitric oxide, leading to improved blood pressure. 6. Adopt a 16-hour daily fasting regimen, with all your regular calorie intake confined to an 8-hour window, such as between 12 p.m. and 6 p.m. This fasting pattern is one of the most effective methods for reducing blood pressure, minimizing oxidative stress, and lowering the risk of arterial blockage. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy.